President, according to Secretary Kennedy, the Trump administration is committed to building the most compassionate Department of Health and Human Services in the history of the United States. So I went to the dictionary and looked up the term compassionate. It means a sympathetic consciousness of others' distress, together with a desire to alleviate it. Yet the proposed Republican budget would make historic billion-dollar cuts to the programs real Americans rely on. Instead of alleviating distress, this big bad bill would actually exacerbate it. And late last night, House Republicans added even more distress to their Medicaid cuts. Changes that would cut care and prevent access to care for millions of Americans. Changes that would cut funding that ensure safe, healthy births for newborns. Changes that will endanger our parents and grandparents who live in nursing homes. So I rise today and seek true compassion from my colleagues and ask, in the words of the famous song, "Where is the love?" I rise today because I have been getting call after call, email after email, meeting with person after person, all worried sick about cuts to Medicaid. And I want to share some of their stories today. I want my colleagues to hear their names and understand the trade-offs they are making to support tax cuts for the wealthy while failing to shrink the national debt. Again, I'm going to say that again, while failing to shrink the national debt. Here are their stories. Emmanuel lives in Sussex County. When I met with him recently, he told me that if we pulled the thread of Medicaid, his whole life would unravel. Emmanuel calls himself a CP warrior, and he doesn't let cerebral palsy or his wheelchair stop him. For Emmanuel, Medicaid is more than prescriptions and doctor's appointments. It is about freedom and independence. Participating in Medicaid allowed him to get and keep a job. Access to Medicaid is how he went from being homeless to being employed to housed and financially secure. It's what enables his wife to be his primary caretaker, while also allowing them to live together as husband and wife. He struggles to plan for his future and that of his family, because his life depends on decisions that we make here in this body. Joy lives in Wilmington with her 34-year-old son, who she says is severely autistic. He receives amazing services from the Delaware Autism Program when he was in school and now attends their day program at Point of Hope. And you guessed it, Point of Hope is funded through Medicaid. Joy is literally terrified of what could happen if these cuts close that program. She doesn't know where her son will end up if they lose the support that Medicaid provides, and she can no longer take care of him. And Nancy lives in Dover with her 19-year-old son, Christopher, who was born prematurely. Christopher coded in the NICU and suffered from a brain injury. As a result, he is on a Medicaid waiver since he was 8 months old. For the last 19 years, Nancy has advocated for her family as well as countless Delawareans. She built her life around caring for Christopher in their home versus an expensive long-term care facility. Medicaid covers the medical equipment Nancy rents to keep Christopher alive. Medicaid covers the skilled medical professionals that help Nancy care for her son and give her respite. Nancy told me that Christopher's life depends on this budget. In her words, the debate about funding cuts feels like the rug is being pulled from under her. Emmanuel, Joy, Nancy, Christopher. These are just many of the stories that I've been told since our Republican colleagues started their crusade against care. These are real people with real needs that Medicaid fills. Real people who we shine the light on and not ignore. And I want my colleagues to hear their names. I want them to remember the names of the people in their own states who are imploring us to stand up and protect their access to care. The Emmanuels, the Joys, the Nancys, the Christophers. So, whether you are a person of faith or just somebody who cares about your neighbor, now is the time to move from the golden rule of treating others as you would like to be treated to the platinum rule, to treat others the way they want to be treated, with real compassion, and to start with protecting Medicaid. Thank you, and I yield back.